Throughout history, humanity has faced numerous challenges posed by infectious diseases. From ancient plagues to modern pandemics, viruses have shaped societies, altered economies, and claimed millions of lives. Understanding the impact of these viruses is crucial for developing effective strategies to combat future outbreaks. Here, we delve into the histories and impacts of 5 of the most dangerous viruses in human history, exploring their origins, transmission, societal consequences, and the efforts undertaken to control them. Smallpox, a disease caused by the variola virus, stands as a testament to humanity's resilience and triumph over infectious diseases. For centuries, smallpox ravaged populations across the globe, leaving death and devastation in its wake. Yet, through the collective efforts of scientists, healthcare workers, and policymakers, smallpox became the first and only human disease to be eradicated, marking a historic milestone in public health. The history of smallpox is deeply intertwined with that of human civilization. Historical records dating back thousands of years reveal accounts of smallpox outbreaks in ancient Egypt, China, and India. The disease thrived in densely populated areas, spreading rapidly through close contact and respiratory droplets. Smallpox epidemics were a recurrent scourge, causing widespread fear and social disruption. The characteristic symptoms of smallpox included fever, malaise, and a distinctive rash that progressed from maculae to papules and eventually to fluid-filled vesicles. These lesions covered the body and often left survivors disfigured or blind. Smallpox had a mortality rate of up to 30%, with higher rates among infants and young children. The devastation wrought by smallpox was not limited to individuals. It had profound societal and economic impacts as well. Outbreaks of smallpox could decimate communities, disrupt trade routes, and destabilize governments. The disease was a significant factor in historical events, influencing wars, migrations, and the course of empires. Despite the toll exacted by smallpox, efforts to control the disease were met with limited success until the introduction of vaccination. The practice of variolation, or inoculation with smallpox material, emerged in Asia and Africa centuries ago as a means of inducing immunity. However, variolation carried risks of severe illness and death and did not provide reliable protection against smallpox. The breakthrough in smallpox control came with the discovery of vaccination by Edward Jenner in the late 18th century. Jenner, a British physician, observed that milkmaids who had contracted cowpox, a related but milder disease, appeared to be immune to smallpox. In 1796, Jenner conducted an experiment in which he inoculated a young boy with cowpox material and later exposed him to smallpox, demonstrating the protective effect of vaccination. Jenner's discovery laid the foundation for the development of the smallpox vaccine, which soon gained acceptance worldwide. Vaccination campaigns were launched, initially using the cowpox virus and later the vaccinia virus, a close relative of smallpox. Mass vaccination efforts, combined with rigorous surveillance and containment measures, gradually brought smallpox under control in many parts of the world. The culmination of these efforts came with the establishment of the World Health Organization's (WHO) Smallpox Eradication Program in 1959. Led by Dr. D.A. Henderson, the program aimed to eliminate smallpox through mass vaccination campaigns, surveillance, and containment of outbreaks. The campaign faced numerous challenges, including logistical hurdles, political unrest, and resistance from some communities. However, through perseverance and collaboration with governments, healthcare workers, and international partners, the program achieved its goal. On May 8, 1980, the World Health Assembly declared smallpox eradicated, marking one of the greatest triumphs in the history of medicine. The eradication of smallpox was a testament to the power of vaccination and international cooperation in combating infectious diseases. It demonstrated that with determination, innovation, and collective action, humanity could overcome even the most formidable health threats. Today, smallpox remains a relic of the past, consigned to the annals of history by the efforts of those who dared to dream of a world free from the scourge of infectious disease. The legacy of smallpox eradication lives on as a beacon of hope and inspiration for future generations in the ongoing fight against emerging health challenges. Influenza, often referred to as the flu, stands as a perennial threat to human health, capable of causing widespread illness and death on a global scale. Its history is marked by recurring pandemics that have shaped societies, altered economies, and tested the resilience of healthcare systems. Understanding the complex dynamics of influenza, from its origins in the natural world to its impact on human populations, is crucial for mitigating its effects and safeguarding public health. The influenza virus belongs to the Orthomyxoviridae family and is classified into types A, B, and C, with type A being the most virulent and responsible for the majority of human infections. Influenza viruses are characterized by their ability to undergo frequent genetic mutations, a phenomenon known as antigenic drift, which enables them to evade immune recognition and cause seasonal epidemics. One of the most infamous chapters in the history of influenza is the Spanish flu pandemic of 1918-1919. Caused by an H1N1 influenza virus strain, the pandemic spread rapidly across the globe, infecting an estimated 1/3 of the world's population and claiming the lives of tens of millions. Unlike seasonal flu outbreaks, which primarily affect the very young and elderly, the Spanish flu disproportionately targeted healthy young adults, leading to a high mortality rate among this demographic. The virus's ability to trigger a severe immune response, known as a cytokine storm, contributed to its devastating impact. Subsequent influenza pandemics, such as the Asian flu 1957-1958, Hong Kong flu 1968-1969, and H1N1 pandemic 2009-2010, further underscored the pandemic potential of influenza viruses. Each pandemic was characterized by the emergence of a novel influenza virus strain with the ability to spread rapidly and cause widespread illness. While the severity of these pandemics varied, they all had significant social, economic, and public health consequences. Influenza viruses are transmitted through respiratory droplets produced when infected individuals cough, sneeze, or talk. The virus can also survive on surfaces for a limited period, contributing to its spread in crowded environments such as schools, workplaces, and public transportation. Seasonal influenza epidemics occur annually, typically during the winter months in temperate regions, and are characterized by a surge in respiratory illness and hospitalizations. The impact of influenza extends beyond the realm of public health, affecting economies, industries, and global supply chains. Influenza-related absenteeism and healthcare costs place a substantial burden on businesses and healthcare systems, leading to productivity losses and strain on resources. The economic toll of influenza epidemics and pandemics underscores the importance of preparedness and response efforts to mitigate their effects. Efforts to control influenza primarily focus on vaccination, antiviral medications, and non-pharmaceutical interventions such as social distancing, hand hygiene, and wearing masks. Annual influenza vaccination campaigns aim to provide immunity against circulating strains and reduce the severity of illness and complications. Antiviral medications, such as oseltamivir and zanamivir, can be used to treat influenza infection and prevent its spread in high-risk populations. Despite these interventions, influenza remains a formidable adversary, capable of causing unpredictable outbreaks and pandemics. The emergence of novel influenza virus strains with pandemic potential, such as avian influenza H5N1 and H7N9, underscores the need for continued vigilance and preparedness. Global surveillance networks, research initiatives, and vaccine development efforts are essential for monitoring influenza activity and responding to emerging threats. In conclusion, influenza represents a perpetual challenge to global health security, characterized by its ability to cause seasonal epidemics and periodic pandemics. The history of influenza is a tapestry woven with threads of resilience, innovation, and collective action in the face of adversity. By understanding the dynamics of influenza transmission, evolution, and impact, we can better prepare for future outbreaks and mitigate their effects on human health and society. HIV/AIDS stands as one of the most devastating pandemics in modern history, with far-reaching impacts on public health, social dynamics, and economic development. Since its emergence in the early 1980s, HIV has infected millions of people worldwide and claimed the lives of over 36 million individuals. The virus, which attacks the immune system, leaves individuals susceptible to opportunistic infections and cancers, leading to significant morbidity and mortality. The human immunodeficiency virus, HIV, belongs to the family of retroviruses and is transmitted through contact with infected bodily fluids, primarily through unprotected sexual intercourse, contaminated blood transfusions, sharing of needles, and from mother to child during childbirth or breastfeeding. The virus targets CD4 cells, a type of white blood cell crucial for mounting an effective immune response against infections. As HIV replicates and destroys CD4 cells, the immune system weakens, eventually leading to the development of acquired immunodeficiency syndrome, AIDS, the advanced stage of HIV infection. The emergence of HIV/AIDS in the early 1980s was met with fear, stigma, and misinformation. Initially perceived as a disease affecting specific marginalized populations, such as men who have sex with men and injection drug users, HIV/AIDS soon spread to affect individuals of all ages, genders, and socioeconomic backgrounds. The lack of effective treatment options and the stigma associated with the disease contributed to widespread discrimination and social ostracization of affected individuals and communities. The global response to the HIV/AIDS pandemic has evolved over time, driven by scientific advancements, advocacy efforts, and community mobilization. The development of antiretroviral therapy, ART, in the mid-1990s revolutionized HIV treatment, enabling individuals living with HIV to lead longer and healthier lives. ART suppresses viral replication, reduces the viral load in the bloodstream, and restores immune function, effectively transforming HIV/AIDS from a death sentence to a manageable chronic condition. In addition to treatment, prevention efforts play a critical role in controlling the spread of HIV/AIDS. These efforts include promoting HIV testing and counseling, providing access to condoms and sterile injecting equipment, implementing harm reduction programs, and promoting comprehensive sexual education. Prevention of mother-to-child transmission programs have also been successful in reducing the risk of HIV transmission from mother to child during childbirth or breastfeeding. Despite significant progress in the fight against HIV/AIDS, challenges remain in achieving universal access to treatment, care, and prevention services. Stigma, discrimination, and criminalization of key populations, such as men who have sex with men, sex workers, and people who use drugs, continue to hinder efforts to control the epidemic. Structural factors, including poverty, gender inequality, and lack of access to health care, further exacerbate the vulnerability of marginalized populations to HIV infection. The impact of HIV/AIDS extends beyond the realm of public health, affecting economies, communities, and social structures. The epidemic has orphaned millions of children, strained healthcare systems, and hindered economic development in some of the world's hardest-hit regions. Addressing the social determinants of health, such as poverty, education, and gender inequality, is essential for achieving sustainable progress in the HIV/AIDS response. Looking ahead, The goal of ending the HIV/AIDS epidemic by 2030, as outlined in the United Nations Sustainable Development Goals, remains within reach but requires renewed commitment and investment. This includes scaling up HIV testing and treatment services, expanding access to pre-exposure prophylaxis, PrEP, for HIV prevention, and addressing underlying social and structural barriers to care. By harnessing the power of scientific innovation, community engagement, and political will, we can overcome the challenges posed by HIV/AIDS and create a future free from the burden of this devastating pandemic. Ebola virus disease, EVD, stands as a stark reminder of the profound impact that emerging infectious diseases can have on human health and society. Named after the Ebola River in the Democratic Republic of Congo, formerly Zaire, where it was first identified in 1976, the Ebola virus belongs to the family Filoviridae and is characterized by its high mortality rate and potential for causing explosive outbreaks. The natural reservoir of the Ebola virus is believed to be fruit bats, which carry the virus without showing symptoms. Human outbreaks typically occur when individuals come into contact with infected animals, such as through hunting or consumption of bushmeat, or through human-to-human transmission via direct contact with bodily fluids of infected individuals. The virus is highly infectious and can spread rapidly within communities, healthcare settings, and during funeral rituals, making containment efforts challenging. Ebola virus outbreaks have occurred sporadically in Central and West Africa, primarily in rural and remote areas with limited access to healthcare infrastructure. The first recorded Ebola outbreak occurred in 1976 in what is now the Democratic Republic of Congo, followed by subsequent outbreaks in Sudan, Gabon, Uganda, and other countries in the region. Each outbreak has been characterized by a combination of factors, including inadequate healthcare resources, weak surveillance systems, and cultural practices that facilitate viral transmission. The clinical manifestations of Ebola virus disease are severe and often fatal, with an average case fatality rate of around 50%, but reaching as high as 90% in some outbreaks. The disease typically begins with non-specific symptoms, such as fever, fatigue, muscle pain, and headache, which can progress to more severe manifestations, including vomiting, diarrhea, rash, and internal and external bleeding. The pathogenesis of Ebola virus infection involves the virus's ability to evade the host immune response, leading to uncontrolled viral replication, immune dysregulation, and widespread tissue damage. The containment of Ebola virus outbreaks requires a multifaceted approach that includes prompt case identification, isolation of cases, contact tracing, infection prevention and control measures, safe burial practices, and community engagement. Healthcare workers on the front lines of outbreak response face significant risks of infection due to their close contact with patients and exposure to contaminated environments. The use of personal protective equipment, PPE, such as gloves, gowns, masks, and goggles, is essential for preventing transmission in healthcare settings. In addition to outbreak response efforts, research and development of medical countermeasures, including vaccines and therapeutics, are essential for controlling Ebola virus disease. The development of the RVSV-ZBOV Ebola vaccine, which was found to be highly effective in clinical trials conducted during the West Africa Ebola outbreak of 2014-2016, represents a significant milestone in the fight against the virus. The vaccine has since been used in outbreak response efforts and as a preventive measure for healthcare workers and at-risk populations. Despite progress in controlling Ebola virus outbreaks, challenges remain in achieving sustained containment and preventing future epidemics. These challenges include addressing underlying social economic and environmental factors that contribute to viral transmission, strengthening healthcare systems and surveillance capacity in affected regions, and fostering international collaboration and coordination in outbreak response efforts. In conclusion, Ebola virus disease continues to pose a significant threat to global health security, with the potential for causing devastating outbreaks and widespread morbidity and mortality. The lessons learned from past outbreaks underscore the importance of preparedness, vigilance, and collaboration in mitigating the impact of emerging infectious diseases. By investing in research, strengthening healthcare systems, and addressing the root causes of disease emergence, we can work towards a future where the ravages of Ebola virus disease are no longer a grim reality. The emergence of the novel coronavirus, SARS-CoV-2, and the resulting pandemic of coronavirus disease 2019, COVID-19, have thrust humanity into an unprecedented crisis, testing our resilience, healthcare systems, and societal cohesion. Since its identification in Wuhan, China in late 2019, COVID-19 has spread rapidly across the globe, causing widespread illness, death, and socioeconomic disruption on an unparalleled scale. SARS-CoV-2 belongs to the family Coronavirinae and is characterized by its ability to cause severe respiratory illness, ranging from mild symptoms to acute respiratory distress syndrome, ARDS, and multi-organ failure. The virus is primarily transmitted through respiratory droplets produced when an infected person coughs, sneezes, or talks, as well as through contact with contaminated surfaces. Its high transmissibility, coupled with a significant proportion of asymptomatic or pre-symptomatic transmission, has contributed to the rapid spread of the virus. The clinical manifestations of COVID-19 vary widely, with common symptoms including fever, cough, shortness of breath, fatigue, and loss of taste or smell. Severe cases may progress to pneumonia and respiratory failure, particularly in older adults and individuals with underlying health conditions such as diabetes, hypertension, and obesity. The disease's unpredictable course, combined with its potential to overwhelm healthcare systems, poses significant challenges for patient management and resource allocation. The global response to the COVID-19 pandemic has been multifaceted, encompassing public health measures, healthcare delivery, scientific research, and socio-economic support. Governments and public health authorities have implemented a range of interventions to contain the spread of the virus, including travel restrictions, quarantine and isolation measures, testing and contact tracing, and the promotion of mask wearing and social distancing. These measures aim to reduce transmission, flatten the epidemic curve, and protect vulnerable populations. The development and deployment of COVID-19 vaccines represent a landmark achievement in the fight against the pandemic. Multiple vaccines have been developed and authorized for emergency use, based on various platforms such as mRNA, viral vector, and protein subunit. Vaccination campaigns have been rolled out globally with the goal of achieving herd immunity and ending the pandemic. However, challenges remain in ensuring equitable access to vaccines, addressing vaccine hesitancy, and overcoming logistical barriers in vaccine distribution. The COVID-19 pandemic has had far-reaching impacts on societies, economies, and daily life. Lockdowns, social distancing measures, and travel restrictions have disrupted businesses, supply chains, and education systems, leading to economic downturns and social unrest. Vulnerable populations, including low-income households, marginalized communities, and frontline workers have borne the brunt of the pandemic's consequences, exacerbating existing inequalities and disparities. The pandemic has also highlighted the interconnectedness of global health security and the importance of international cooperation in responding to emerging health threats. Collaboration among governments, multilateral organizations, researchers, and industry partners has been essential for sharing data, coordinating response efforts, and accelerating research and development of diagnostics, treatments, and vaccines. Looking ahead, the COVID-19 pandemic serves as a wake-up call for strengthening pandemic preparedness, resilience, and health systems worldwide. Investments in public health infrastructure, surveillance capacity, and research and development are essential for mitigating the impact of future pandemics. The lessons learned from COVID-19 underscore the need for a coordinated, science-driven approach to pandemic response, grounded in solidarity, equity, and compassion. As we navigate the challenges of the pandemic, let us remain vigilant, adaptive, and united in our efforts to overcome this global crisis and build a healthier, more resilient world for future generations.